My question is, was there a fear of vaccines during their emergence in the 17 and 1800s? Did doctors and scientists attempt to educate the public about this new innovation? And if so, how? So, what are vaccines and how do they work? Well, vaccines function by mimicking an infection, triggering the body's immune response as if a harmful organism were present. The key component in all vaccines is an antigen, a substance that stimulates the immune system to start producing antibodies. The main disease we'll be working with is smallpox. It transmits through droplets, cough, sneeze, talk, close contact, and contaminated objects such as bedding, clothing, etc. The incubation period is 7 to 17 days after exposure. You become infectious only after developing a fever, and you remain infectious until the last scab falls off. The fatality rate on average is around 30%. You do see a lot of permanent scarring, especially on the face, and that can become so severe that some people actually become blind. After a global vaccination campaign led by the World Health Organization, smallpox was officially declared eradicated in 1979, making it the first disease to ever be eradicated by human intervention. Variolation, the vaccine precursor. Variolation was the deliberate infection of a healthy subject with smallpox in the hope of preventing the natural attacks of the disease. This aimed to improve on nature, right? Building on the observation that people who had survived smallpox never caught it again. Some of the first reported use cases of it was in ancient China, dating back to 1550 or earlier. They used the method called nasal insufflation, or blowing of powdered smallpox material, usually ground up scabs, up the nostrils. Introducing variolation into the West. This was done by, mainly accredited at least, to Lady Mary Wortley Montagu. She was an influential and determined English aristocrat. She became passionate advocate for variolation after observing it in Turkey. Motivated by her own battle with smallpox, which scarred her face and nearly killed her, and her frustrations with the medical profession's failure to save her, she used her persuasive skills and extensive social network to promote the practice. She did, however, do some pretty unethical things. She performed experiments on orphan children and prisoners to introduce inoculation to the West, right? In 1721, she used variolation on her own daughter, and in 1722, after showing its efficacy in 2 prisoners, the king actually allowed 2 of his granddaughters to get inoculated. So she successfully introduced variolation to British high society, right? She achieved what a lot of people couldn't do, which other earlier advocates had not been able to do. However, variolation was not perfect. It did not provide lifetime immunity. It also required sick people to help non-sick people. It was impossible to calculate the number of collateral deaths due to inoculation. It took only 1 infectious inoculi to ignite an entire outbreak. Then we get Edward Jenner and the cowpox. Which, the first vaccine, right? The story goes that Edward Jenner observed that dairy maids who contracted cowpox seemed naturally immune to smallpox. In May of 1796, he tested this idea by inoculating an 8-year-old boy, James Phipps, with material from a cowpox lesion on a dairy maid named Sarah Nelms. The boy experienced mild symptoms but quickly recovered. 2 months later, Jenner exposed the boy to smallpox, but no illness developed, confirming that cowpox provided immunity to smallpox. This experiment marked a breakthrough in vaccination. So once this vaccine actually becomes more popular, so we get some governmental responses to it, right? We get a lot of mandatory vaccine laws in Europe. We're going to mainly focus on Britain. So you have the Vaccination Act of 1840, which outlawed variolation and provided free vaccinations for the poor. Then we see the Vaccination Act of 1853, which made it compulsory for children born after August 1st, 1853 to be vaccinated within 3 months of life. And then we have the Vaccination Act of 1867, which made it compulsory for all children under 14 to be vaccinated. And parents could be fined or even jailed for non-compliance. In the United States, we do see a Supreme Court decision, Jacobson versus Massachusetts in 1905, which did rule that it is constitutional to have mandatory vaccine laws. So we get the cultural responses to the smallpox vaccine, right? We start seeing anti-vaccine movements, and this is mainly, you see the biggest movement in England at the time, right, in that Western Europe. You get two large groups, the Anti-Vaccination League and the Society for the Abolition of Compulsory Vaccinations. And usually these anti-vaccines fall within one of four categories, and you'll still see this in modern day anti-vaccine movements. The first one being that vaccines are ineffective. The second, that vaccines are against God's will or unnatural. 3, that you'll become contaminated because it uses animal material. Now, you don't really see this one so much in modern day anti-vaccine arguments, but you will see that like the materials within the vaccine are toxic. And then you have mandatory vaccine laws are a threat to civil liberties. So let's look at the first one, that vaccines are ineffective. So we have two major studies coming out at the time that people who are anti-vaccine use, right? The first one is a study from Professor Vogt of the Hygiene Institute in Bern. He studied 40,000 smallpox deaths and found that most had been vaccinated, and this study was widely used in anti-vaccine groups. Then we have the second one, Dr. Leander Joseph Keller. He had the medical records of the Austrian Railway Company. Following an outbreak in 1872 and 73, Keller looked at 2,600 cases of smallpox, 470 of whom died, with a total population of 55,000. He compared death rates between the vaccinated and unvaccinated and showed throughout all age groups, vaccinated people having higher mortality rate than the unvaccinated. So obviously this spurred great debate, right? People from both sides were scrambling to support their sides. The Vogt study had a few reasons why it may have showed this way. One, people were often claiming to be vaccinated when they didn't, to avoid fines or possibly jail time. 2, the protective effect of the vaccine was wearing off, right? Jenner claimed it was for life. The Keller study was found out later that he just straight up fabricated his data, and the data actually showed that deaths were less frequent among the vaccinated. However, this data was still used very commonly within anti-vaccine groups. Jenner supporters fabricated data to show lifelong immunity when this was not the case, and this fierce belief caused Britain not to encourage revaccinating until 1871. We can see a great example of this in Prussia. It shows the efficacy of revaccinating rather than just vaccinating. So vaccination was introduced in Prussia in 1835 with little effect, and the death rates continued to be around 2,000 per million per year. In 1874, we see compulsory revaccination, and the deaths dropped to less than 20 per million per year. And then the second one, the second argument, that vaccines are against God's will, right? Here we have an excerpt from Our Medical Liberties, and he says, merely to draw attention to the fact that many persons reject vaccination on a religious grounds. As one of the local registrars expresses it, parents frequently refuse to have their children vaccinated as they say they will suffer the Lord to work his will, and the vaccination is bringing sickness upon their children. So we kind of see a twofold argument, right? That the Lord is to work his will. So that it's the Lord's will whether they get sick or not, or whether they die or not from, being sick. And that the vaccine goes against this, right? And then also that it's bringing sickness upon their children, so that the vaccine is actually causing a sickness. And I think this is where, the legacy of variolation is coming into play. He goes on to say that such objections are not confined to the lower classes. We have admissions from the Lancet. There is one objection which assuredly would not yield to the bill in question. We refer to the so-termed religious objections to vaccination, which we happen to know are not confined to the poor and ignorant, having met with them in quarters where very different views might have been expected. They are of two kinds. Some are of the opinion that we have no right to expose ourselves to the evils and dangers resulting from vaccination in order to prevent a future, probably a distant, and a certainly fortuitous evil. Others object on the broad ground that we should leave the providence to determine the nature of our corporal afflictions. So, another twofold argument. One is saying that the vaccine itself is evil and that it's dangerous. The others are saying that we shouldn't interfere, with nature, with God's nature and how he built us and how, whether we should get sick or not. Then we have contaminated because it uses the animal material. So we see a lovely picture here, cartoon called the cowpox, or the wonderful effects of the new inoculation. And we see here a depiction of Jenner inoculating people with the cowpox vaccine. And we see people are starting to literally turn into cows or having cows come out of them. We see one person here, literal horns growing out of his head. We have people's arms turning into cows. You even see up top here a little depiction that now cows are being revered and being worshipped too, right? We also see this one, and this is definitely after the, it was required for babies after 3 months to become vaccinated, right? We see here that this woman is handing back a baby who has turned into a cow after being vaccinated. And then we see that mandatory vaccines laws are a threat to civil liberties. We have a letter here to the Secretary of State, the Home Department. He says, "Sir, I humbly beg to protest against the passing of the bill on compulsory vaccination, which I look upon as a gross infringement on the medical liberty of the subject. I further beg to represent to you that many professional persons and others are of the opinion that vaccination not only does not prevent smallpox, but it is productive of worse and more dangerous diseases. Such being the case, I hope you will present this my protest to the House of Commons." So obviously he's straight up saying it is an infringement on the medical liberties of the person, right? But then he's also saying, that the vaccine it's not efficacious. And it actually can cause worse and more dangerous diseases. So again, we have a fundamental misunderstanding of how the vaccine works. We have another excerpt here from a lecture. He says, "Now be it remembered that a vaccination is a protection against smallpox, that this argument falls at once to the ground, because then the danger only exists to those who are not vaccinated, and those who prefer to be vaccinated have no right to coerce those who do not wish to be vaccinated. Be it remembered, moreover, that this demand for compulsion has come upon the country just in proportion as the vaccination has been proved to have failed." Again, another fundamental misunderstanding of how the vaccines work, right? He's saying, well, the danger only exists to those who are not vaccinated, so then why should you force? Well, obviously, this is a misunderstanding of how vaccines work, right? We want to get, a certain number of people, right, to achieve something called herd immunity, right? So that the disease can't continue to spread and evolve. And it also protects those who can't be vaccinated, if they, say, are immunocompromised. And then he's just saying that straight up, the vaccine has been proved to have failed. So again, he's probably referring to those previous studies where it's showing that vaccines are not efficacious. Then we see some other responses by the scientific communities. obviously the big ones coming out of England at the time were the compulsory laws coming out of the government, but we see some other ones. In 1803, the Philadelphia Dispensary, supported by 50 physicians, including Benjamin Rush, compared smallpox vaccination to crossing a safe bridge, while contracting smallpox was like swimming across a dangerous, fast-moving river with a 1 in 6 chance of dying. They declared it their duty to promote the vaccine as a reliable way to prevent smallpox and encourage its widespread use. In 1830, we see President Madison signed into law to boost vaccination efforts by creating the United States Vaccine Agency and required the Postal Service to deliver smallpox vaccine materials for free.